This video will focus on the diagnosis and assessment of concussions. The information has been provided by the Ontario Neurotrauma Foundation's Best Practice Guidelines for Concussions and Mild Traumatic Brain Injuries. The early recognition and diagnosis of a concussion are essential first steps towards the successful management of this injury. The clinical presentation of a concussion is often variable, and patients are often unaware that they have sustained this injury. As a result, clinicians should be highly suspicious of these injuries, especially in cases where there is evidence of direct head trauma or another common mechanism of injury. This can include a motor vehicle accident, falls, assaults, and unintentional strikes by or against an object. With sport-related activity, anyone can recognize a concussion, but only a physician can formally diagnose the individual. Any player suspected of sustaining a concussion should immediately be removed from play and may not return to the game or practice before being medically assessed by a qualified healthcare professional. Common signs and symptoms of a concussion include any period of loss or decreased level of consciousness less than 30 minutes, any amnesia immediately before or after the injury shorter than 24 hours, any alteration in mental states and physical symptoms such as headache and dizziness. The goal of the initial medical assessment is to diagnose the patient with a mild traumatic brain injury by ruling out more severe forms of traumatic brain injury, cervical spine injuries, and other medical and neurological conditions that can present similar concussion-like symptoms. A comprehensive assessment should be conducted on the presentation of symptoms, which includes a history, examination, and cognitive screen for post-concussive symptoms and a review of mental health. There are several tools that are recommended for assessing the patient, which will be provided below this video. For athletes in cases where a concussion is suspected without a more severe head or spinal injury, a player should be removed from the field of play and a sideline assessment can be performed. Tools for sideline evaluation and information that can be provided to the athlete can also be found below this video. This severity of symptoms observed in the acute phase of injury is the strongest and most consistent predictor of a slower recovery. Symptoms should be formally documented at the time of the initial assessment in the event that these persist. The Canadian CT head rule should be used to determine whether early neuroimaging is required. A CT head scan is only required for minor head injuries with any of the following findings. If they are at high risk, a GCS score below 15 at 2 hours after the injury, suspected open or depressed skull fracture, any sign of basal skull fracture, 2 or more vomiting episodes, or if the individual is over the age of 65. If they are at medium risk, amnesia before impact that is 30 minutes or longer, or if the individual experienced a dangerous mechanism of injury. Following a diagnosis, it is important to educate the patient about the expected symptoms and duration to help the patient in anticipating and understanding their recovery. Along with additional instructions for a follow-up visit, a patient-informed approach has been shown to be an effective strategy in preventing the development of persistent symptoms. Several written and verbal brain injury advice cards can be found below this video. Throughout the recovery process, if symptoms are not resolving along expected timelines, specialty referrals should be arranged. There are several risk factors that may delay recovery, which are listed in Table 1.1. Patients with these factors may require close monitoring or an accelerated intervention strategy. The primary care provider should explore and document these during the initial assessment and follow-up visits. The guidelines' key recommendations are as followed. Concussions should be recognized and diagnosed as soon as possible to improve positive health outcome for patients. A concussion can be recognized in the community by a non-medical professional, however, the diagnosis needs to be made by a qualified healthcare professional. On presentation, the primary care provider should conduct a comprehensive review of every patient who has sustained a concussion, and the need for early neuroimaging should be determined by the Canadian CT head rule. For further information regarding the diagnosis of concussions, you can refer to Section 1 of the Ontario Neurotrauma Foundation's Guidelines for Concussions and Their Persistent Symptoms. Special acknowledgements go out to the Kinesiology Department at the University of Waterloo, the Centre for Community, Clinical and Applied Research, and the Ontario Neurotrauma Foundation, which provided the funding for this video.